Have you ever wondered why your knees feel stiffer each morning, even though you haven't been doing anything strenuous? Why does getting up from your favorite chair take a little extra effort now? Why do those stairs that you used to climb without thinking twice now make your knees ache with each step? You might think it's just the natural progression of aging. After all, everyone tells you that joint pain is normal after 60. But what if I told you that the gradual destruction of your knee joints isn't just about getting older? What if the real culprits are four seemingly innocent habits you perform every single day? Habits that you've been told are harmless, or even healthy. Habits that you do without thinking, believing they're part of a normal, active lifestyle. The truth is, millions of seniors unknowingly damage their knee joints daily through activities they consider completely safe. These aren't extreme sports or heavy lifting. These are quiet, subtle habits that slowly but systematically wear down the cartilage in your knees, inflame the surrounding tissues, and accelerate the very joint degeneration you're trying to prevent. Here's what makes this so dangerous. The damage is invisible and painless at first. You can't see your cartilage slowly wearing away. You can't feel the microscopic tears forming in your joint structures. By the time you start experiencing that persistent ache, that morning stiffness, or that sharp pain when you stand up, significant damage has already occurred. But here's the part that might shock you. These four habits are so common, so accepted, that you probably did at least one of them within the last 24 hours. In fact, you might be doing one right now as you watch this video. The medical community rarely talks about these daily habits because they seem so benign. Your doctor might mention general advice about staying active, but they don't warn you about the specific activities that are quietly destroying your knee joints from the inside out. Today, we're going to expose these four habits, explain exactly how they're damaging your knees, and most importantly, give you simple alternatives that can protect and even strengthen your knee joints. By the end of this video, you'll never look at these harmless activities the same way again. Let's start with the first habit that's quietly destroying knee joints in seniors. Extended sitting with crossed legs. This might seem completely harmless. You're sitting comfortably in your living room, watching television, reading a book, or having a conversation. Naturally, you cross one leg over the other. It feels relaxed, elegant even. But here's what's happening inside your knee joint that you can't see or feel. When you cross your legs, especially for extended periods, you're creating an unnatural angle and pressure point in your knee joint. The knee is designed to bend in one primary direction, forward and back, like a hinge. When you cross your legs, you're adding a twisting lateral stress that your knee joints were never designed to handle repeatedly. The hidden damage process. Here's the scientific reality of what occurs when you sit with crossed legs for more than 10-15 minutes at a time. The pressure from your upper leg pressing down on your lower leg creates compression in the knee joint underneath. This compression reduces the space available for synovial fluid, the lubricating liquid that keeps your knee joint moving smoothly. Think of synovial fluid like the oil in your car's engine. When there's not enough circulation of this fluid, the cartilage in your knee, which has no blood supply of its own, begins to dry out. Dry cartilage becomes brittle, rough, and prone to cracking. But the damage goes deeper. The twisted position also puts abnormal strain on your meniscus, those crucial C-shaped pieces of cartilage that act as shock absorbers between your thigh bone and shin bone. Every minute you spend in this position, microscopic tears can form in these delicate structures. Circulation connection. There's another devastating effect that most people never consider. Crossing your legs significantly reduces blood circulation to your lower extremities. The pressure from your upper leg compresses blood vessels in your lower leg, reducing the flow of oxygen and nutrients to your knee joint. Your knee joint depends on good circulation to deliver the building blocks it needs for repair and maintenance. When you regularly restrict this blood flow, you're essentially starving your knee joint of the resources it needs to stay healthy. Many seniors notice that their legs feel numb, tingly, or fall asleep when they sit with crossed legs. This is your body's warning system telling you that circulation has been compromised. But the damage to your knee joint is happening even before you feel these obvious symptoms. The muscle imbalance effect. Here's something even more insidious. Regularly sitting with crossed legs creates muscle imbalances around your knee joint. The muscles on the outside of your thigh, your IT band and lateral quadriceps, become tight and overactive, while the muscles on the inside of your thigh become weak and underactive. This imbalance changes how your kneecap tracks when you walk, climb stairs, or stand up. Instead of gliding smoothly in its groove, your kneecap begins to pull to one side, creating friction and uneven wear patterns on the cartilage underneath. Over months and years, this uneven wear creates rough, damaged areas in your knee joint, the beginning stages of osteoarthritis. The worst part? This process is completely silent until the damage becomes severe enough to cause pain. Real-world impact. Have you ever noticed that after sitting for a long time with your legs crossed, it takes a moment to get going when you stand up? That stiffness, that moment of instability, that brief, sharp pain, those are all signs that your knee joint has been compromised by the position you were sitting in. Some seniors report feeling like their knees are locked up after sitting with crossed legs for extended periods. Others experience a grinding or clicking sensation when they first start walking. These are warning signs that cartilage damage may already be occurring. The better alternative. Instead of crossing your legs, try these knee-friendly sitting positions. Keep both feet flat on the floor, with your knees at roughly 90-degree angles. If your feet don't comfortably reach the floor, use a footrest to support them properly. If you need to change positions frequently, try crossing your legs at the ankles rather than at the knees. This gives you variety without putting harmful stress on your knee joints. Take regular standing and walking breaks every 20-30 minutes. Even a brief 30-second walk around your chair can restore circulation and relieve pressure on your knee joints. The key is awareness. Once you understand how this seemingly harmless habit affects your knees, you can make conscious choices to protect them throughout the day. The second habit that's silently destroying senior knee joints might surprise you: frequent stair climbing without proper technique. Now, you might think, wait, isn't stair climbing supposed to be good exercise? And you'd be partially right. Stair climbing can be excellent cardiovascular exercise and can strengthen your leg muscles when done correctly. But here's the crucial point. Most seniors over 60 are climbing stairs in a way that dramatically increases wear and tear on their knee joints. The technique problem. The issue isn't that you're using stairs, it's how you're using them. Most people learn to climb stairs as children and never adjusted their technique as their bodies aged. What worked for your 20-year-old knees can be devastating for your 60-plus-year-old knees. Here's what typically happens. You approach the stairs and automatically start climbing the way you always have, leading with the same leg, taking steps that are too large for your current stride length, gripping the handrail only for balance rather than support, and most critically, landing hard on each step without controlling the impact. The going up damage. When you go upstairs incorrectly, here's what happens inside your knee joint. As you lift your body weight up to the next step, the forces on your knee joint can be 3 to 4 times your body weight. If you weigh 150 pounds, that's potentially 450 to 600 pounds of force concentrated on your knee with each step. But it's not just the amount of force, it's how that force is applied. When you don't use proper technique, much of that force gets concentrated on a small area of your kneecap and the cartilage underneath it. Instead of distributing the load evenly across your entire knee joint, you're creating pressure points that wear down specific areas of cartilage. Many seniors have a tendency to pull themselves upstairs using their arms on the handrail while simultaneously pushing with their legs. This creates a shearing force in the knee joint, a sideways stress that your knees weren't designed to handle repeatedly. The going down devastation. If going upstairs incorrectly is bad for your knees, going downstairs with poor technique is catastrophic. When you descend stairs, the forces on your knee joints can reach 5 to 7 times your body weight. That same 150-pound person could be subjecting their knees to over 1,000 pounds of force with each downward step. Here's the technique mistake that's destroying senior knees. Most people drop down to the next step rather than controlling their descent. They lead with their weaker leg, land heavily on their heel, and allow their knee to absorb all the impact shock. This creates what orthopedic surgeons call impact loading, sudden jarring forces that compress the cartilage in your knee joint. Over time, this repeated compression causes the cartilage to break down, flatten out, and lose its ability to cushion your knee joint. The frequency factor. Now you might think, I don't climb that many stairs. But consider this. How many times do you go up and down the stairs in your home each day? To get to your bedroom, to do laundry in the basement, to access storage areas. Even if you only climb one flight of stairs 4 to 6 times per day, that's potentially 2 to 3,000 damaging impacts on your knee joints each year. Multiply that by the number of years you've been using improper stair technique, and you can see how significant damage accumulates. Many seniors live in multi-level homes and don't realize that their daily stair use, something they consider normal and necessary, could be the primary factor in their developing knee problems. The muscle compensation problem. Here's another way improper stair climbing damages your knees. When you don't use correct technique, other muscles have to compensate for the inefficiency. Your hip flexors, lower back muscles, and even your ankle muscles begin working harder to help you navigate stairs. This compensation pattern changes the biomechanics of your entire leg. Instead of your large, powerful glute and quadriceps muscles doing most of the work, smaller, weaker muscles around your knee joint are forced to take on more load than they can handle. Over time, this leads to muscle imbalances, joint instability, and increased wear on your knee cartilage. You might notice that your knees feel wobbly or uncertain on stairs, or that you grip the handrail tighter than you used to. These are signs that your knee joint stability has been compromised. The proper technique solution. Here's how to climb stairs safely and protect your knee joints. Going up, always lead with your stronger leg. Use the handrail for support. Not just balance, actually pull some of your body weight with your arms. Take smaller steps that feel comfortable for your current stride length. Land softly on the ball of your foot, then roll back to your heel. Keep your knee aligned over your toes. Don't let it cave inward. Going down. Lead with your weaker leg. This puts your stronger leg in the better position to control your descent. Use the handrail to control your speed and take weight off your legs. Step down slowly and deliberately. Never drop to the next step. Land on the ball of your foot first, then lower your heel. Keep your torso upright. Don't lean forward. Frequency management. Plan your trips up and down stairs to minimize unnecessary climbing. Take breaks if you need to climb multiple flights. Consider whether items you use daily should be relocated to reduce stair use. If you experience knee pain during or after stair climbing, it's a sign to modify your approach immediately. The goal isn't to avoid stairs entirely. It's to use them in a way that protects your knee joints while maintaining your mobility and independence. The third habit that's quietly destroying your knee joints happens while you're completely unconscious. Sleeping in positions that stress knee joints. You spend approximately 1/3 of your life sleeping, which means you spend about 8 hours every single night in whatever position your body settles into. If that position places stress on your knee joints, you're subjecting them to potentially damaging forces for 56 hours every week, nearly 3,000 hours per year. Most seniors have never considered how their sleeping position affects their knee health, but the reality is that poor sleep positioning can be just as damaging as improper exercise technique. The side sleeping problem. The most common sleep position that damages knee joints is side sleeping without proper support. When you lie on your side, gravity causes your top leg to fall across your body, creating a twisted, stressed position for both knees. Here's what happens. Your bottom knee bears the weight of your entire leg in a bent position for hours at a time. The pressure compresses the cartilage on the inside of that knee joint, reducing circulation and limiting the flow of synovial fluid that keeps the joint lubricated. Meanwhile, your top knee is stretched and twisted as your leg falls across your body. This position puts stress on the ligaments and soft tissues around your knee joint and can create abnormal tension patterns that persist even after you wake up. Many seniors report waking up with stiff, aching knees, especially after sleeping on their side. This morning stiffness isn't just normal aging. It's often a direct result of how you position your joints during sleep. The stomach sleeping disaster. Sleeping on your stomach creates even more problems for your knee joints, though many people don't realize the connection. When you sleep on your stomach, you typically turn your head to one side to breathe, which creates a twisted position for your entire spine. This spinal twist travels down through your pelvis and into your legs, forcing your knees into an unnatural rotation. Additionally, stomach sleeping often causes people to bend one knee up toward their chest while keeping the other leg straight, creating dramatically different stress patterns on each knee joint. But here's the most insidious part. Stomach sleeping often requires you to use multiple pillows or contort your legs to get comfortable. These awkward positions can maintain harmful stress on your knee joints for the entire duration of your sleep. The circulation connection. Poor sleep positioning doesn't just create mechanical stress on your knee joints, it also impairs circulation to these critical areas. When your knees are bent, twisted, or under pressure for hours at a time, blood flow to the joint structures is reduced. Your knee joints depend on good circulation to deliver oxygen and nutrients to the cartilage and other joint structures. They also need adequate blood flow to remove waste products and inflammatory substances that can accumulate in the joint space. When circulation is restricted during sleep, your knee joints are essentially starving for the resources they need to repair and maintain themselves. Over time, this can lead to accelerated cartilage breakdown and increased inflammation. The morning stiffness connection. Have you ever noticed that your knees feel particularly stiff and achy when you first get out of bed? Many seniors accept this as normal aging, but it's often a direct result of poor sleep positioning. During sleep, synovial fluid, the lubricating liquid in your knee joints, becomes thicker and less mobile, especially if your joints have been in stressed positions. When you first wake up and try to move, this thick fluid doesn't flow properly, creating that feeling of stiffness and resistance. If your knees were in harmful positions during sleep, this morning stiffness is often accompanied by pain, aching, or a feeling that your knees need to warm up before they work properly. This is your knee joint's way of telling you that they've been stressed during the night. The long-term damage. What makes sleep-related knee damage so dangerous is its cumulative nature. Unlike daytime activities where you might feel immediate discomfort if you're doing something harmful, sleep position damage occurs gradually and silently. Night after night, poor positioning creates microscopic wear on your cartilage, subtle stretching of your ligaments, and gradual compression of your joint structures. By the time you start experiencing obvious symptoms, significant damage may have already occurred. Many seniors don't connect their knee problems with their sleep habits because the damage occurs so slowly. They might blame their knee pain on activities they did during the day, never realizing that their sleep position was the primary culprit. The proper sleep solutions. Here's how to position yourself during sleep to protect and support your knee joints. For side sleepers, place a pillow between your knees to keep your legs parallel and prevent your top leg from falling across your body. Use a pillow that's thick enough to maintain the natural alignment of your legs, but not so thick that it pushes your top leg upward. Consider a contour pillow specifically designed for knee support. These maintain proper positioning even if you move during sleep. Keep both knees slightly bent in a comfortable, natural position. For back sleepers, place a pillow under your knees to maintain a gentle bend and reduce stress on your lower back and knee joints. Avoid pillows that are too high, which can create excessive knee flexion. Consider a wedge pillow under your legs for more consistent support throughout the night. For those who must sleep on their stomach, use a thin pillow or no pillow under your head to reduce spinal twist. Place a pillow under your pelvis to reduce lower back stress and keep your legs in better alignment. Try to keep both legs straight rather than bending one knee up toward your chest. Additional sleep environment modifications. Ensure your mattress provides adequate support. A mattress that's too soft can allow your body to sink into positions that stress your joints. Consider the height of your bed. Getting in and out should not require excessive knee bending or straining. Keep your bedroom at a comfortable temperature, as cold environments can increase joint stiffness. The goal is to maintain natural, relaxed positioning for your knee joints throughout the night, allowing them to rest and recover rather than being stressed for hours at a time. The fourth and perhaps most overlooked habit that's destroying knee joints in seniors is wearing improper footwear during daily activities. Your feet are the foundation of your entire kinetic chain. Every step you take sends forces up through your ankles, into your knees, through your hips, and up your spine. When your feet aren't properly supported, those forces become uneven, excessive, and damaging to your knee joint. Most seniors have been wearing the wrong shoes for their knee health for years, if not decades, without realizing the cumulative damage they're causing with every single step. The high heel disaster. Let's start with the most obvious culprit, high heels. Even small heels of just 1 to 2 inches can dramatically alter the biomechanics of your knee joint. When you wear heels, your body weight shifts forward onto the balls of your feet, forcing your knees to work harder to maintain balance and stability. Here's the specific damage. High heels increase the compressive forces on the kneecap by up to 26%. This means every step you take in heels is subjecting your knee joint to significantly more pressure than it was designed to handle. But it's not just about the amount of force. It's about where that force is concentrated. High heels cause your kneecap to track differently in its groove, creating uneven wear patterns on the cartilage underneath. Over time, this leads to what doctors call patellofemoral pain syndrome, a breakdown of the cartilage behind your kneecap. Many senior women who wore high heels regularly in their younger years are now experiencing knee problems that can be directly traced back to decades of altered knee mechanics. The damage was happening silently with every step and only becomes apparent years later. The flat shoe problem. But here's what might surprise you. Completely flat shoes can be just as damaging to your knee joints as high heels, especially for seniors. When you wear shoes with no arch support or heel elevation, your foot tends to roll inward with each step, a motion called overpronation. This inward rolling causes your shin bone to rotate internally, which in turn causes your kneecap to track improperly. Over thousands of steps each day, this abnormal tracking pattern creates wear on specific areas of your knee cartilage. You might notice that your knees ache after walking in flat shoes, or that you feel more knee pain on days when you wear certain shoes. The worn-out shoe catastrophe. One of the most common mistakes seniors make is continuing to wear shoes long after they've lost their supportive properties. That comfortable pair of walking shoes you've had for years might feel great because they're broken in, but they could be destroying your knee joints. Here's what happens. As shoes age, the arch support collapses, the heel cushioning compresses, and the sole wears unevenly. These changes alter how your foot strikes the ground and how forces travel up through your leg to your knee joint. Worn-out shoes often create subtle imbalances that you don't consciously notice, but your knee joints feel with every step. You might experience increased knee stiffness, aching, or instability without realizing that your old comfortable shoes are the culprit. The wrong size epidemic. Shocking fact, up to 80% of seniors are wearing the wrong shoe size. As we age, our feet naturally spread and lengthen due to ligament stretching and changes in foot structure. Many seniors are still wearing the same shoe size they wore in their 30s or 40s, not realizing their feet have changed. When shoes don't fit properly, your gait changes to accommodate the discomfort. You might take shorter steps, land differently on your feet, or shift your weight in unnatural ways. All of these compensations create altered forces on your knee joints. Shoes that are too small can cause you to grip with your toes, creating tension that travels up through your leg muscles and affects knee alignment. Shoes that are too large can cause your feet to slide around, creating instability that your knee joints have to compensate for. The activity-specific problem. Many seniors make the mistake of wearing the same shoes for all activities, regardless of what those activities demand from their feet and knees. The shoes that are perfect for grocery shopping might be terrible for gardening or walking on uneven surfaces. Different activities create different force patterns and require different types of support. When you wear inappropriate footwear for specific activities, you're asking your knee joints to compensate for the lack of proper support, which can lead to accelerated wear and tear. The hidden damage process. Here's how improper footwear systematically damages your knee joints. Every step you take in the wrong shoes creates a slightly abnormal force pattern. These abnormal forces cause your knee joint to move in ways it wasn't designed to move, creating microscopic wear on your cartilage, ligaments, and other joint structures. Over the course of a day, you might take 3,000 to 5,000 steps. Over a year, that's over 1.5 million steps in shoes that are potentially damaging your knee joints with each impact. The damage is cumulative and often invisible until it becomes severe. You might not feel any immediate pain or discomfort, but years of improper footwear can lead to osteoarthritis, chronic knee pain, and mobility limitations. The proper footwear solutions. Here's how to choose and use footwear that protects rather than damages your knee joints. Daily walking shoes. Choose shoes with good arch support that matches your foot type. Ensure adequate heel cushioning to absorb impact forces. Replace walking shoes every 300 to 500 miles of use, or every 6 to 12 months for daily wear. Look for shoes with a slight heel elevation, about 1/2 inch, rather than completely flat soles. Sizing guidelines. Get your feet measured professionally at least once every few years. Shop for shoes in the afternoon when your feet are at their largest. Ensure there's a thumb width of space between your longest toe and the end of the shoe. Make sure the widest part of your foot aligns with the widest part of the shoe. Activity-specific footwear. Use supportive, closed-toe shoes for yard work and gardening. Wear shoes with good traction for outdoor activities. Choose supportive sandals with arch support for casual summer wear. Consider orthotic inserts if you have specific foot or knee problems. Daily habits. Rotate between different pairs of supportive shoes to vary the stress patterns on your feet and knees. Inspect your shoes regularly for uneven wear patterns, which can indicate gait problems. Replace shoes before they become completely worn out. Don't wait for obvious signs of breakdown. Red flags to watch for: knee pain that's worse on days you wear certain shoes, increased knee stiffness after walking or standing, feeling like your knees are unstable or unreliable, knee pain that seems to correlate with specific activities or surfaces. Remember, your shoes are the interface between your body and the ground. Every step you take transmits forces through this interface directly to your knee joints. Making sure this interface is supportive, properly fitted, and appropriate for your activities is one of the most important things you can do to protect your knee health. Now that we've exposed these 4 dangerous habits, it's crucial to understand how they work together to damage your knee joints. The real devastation isn't from any single habit, it's from the cumulative effect of multiple harmful behaviors happening simultaneously over months and years. How the damage compounds. Think about a typical day in your life. You might start by getting out of bed after spending 8 hours in a position that stressed your knee joints. Then you put on worn-out shoes and walk downstairs using improper technique to get your morning coffee. Later, you spend several hours sitting with your legs crossed while reading or watching TV. Each of these activities alone might cause minimal damage, but when combined and repeated daily, they create a perfect storm of joint destruction. Your knee cartilage never gets a chance to recover because it's being stressed by different harmful forces throughout the day. The warning signs you can't ignore: your body is constantly sending you signals about the health of your knee joints. The key is learning to recognize these early warning signs before permanent damage occurs. Morning stiffness. If your knees feel stiff, achy, or resistant to movement when you first get out of bed, this is often a sign that your sleep position is stressing your joints. Healthy knees should feel relatively comfortable upon waking. Stair-related pain. Any sharp pain, aching, or feeling of instability when going up or down stairs is a red flag. This often indicates that your stair climbing technique is causing damage, or that accumulated damage is reaching a critical point. Post-sitting stiffness. If you feel stiff or sore when getting up after sitting for extended periods, especially if you've been sitting with crossed legs, this suggests that your sitting habits are compromising your knee joint health. Shoe-related symptoms. Pay attention to whether certain shoes make your knees feel worse. If you notice increased knee discomfort on days you wear specific footwear, those shoes are likely contributing to joint stress. Weather sensitivity. While many people joke about being able to predict the weather with their joints, increased sensitivity to weather changes often indicates that inflammation and joint damage are present. Grinding or clicking. Any grinding, clicking, or popping sounds from your knees during movement can indicate cartilage damage or irregular joint surfaces. The progression pattern. Knee joint damage from these habits typically follows a predictable pattern. Stage 1. Occasional mild stiffness or achiness, usually dismissed as normal aging. Stage 2. More frequent discomfort, especially with weather changes or after certain activities. Stage 3. Daily symptoms that begin to limit activities or require pain medication. Stage 4. Significant pain and mobility limitations that affect quality of life. The good news is that catching and addressing these habits in stages 1 or 2 can often prevent progression to the more severe stages. The most important thing to understand is that it's never too late to start protecting your knee joints. Even if you've been engaging in these harmful habits for years, making changes now can prevent further damage and may even allow some healing to occur. Immediate action steps for your sitting habits. Set a timer to remind yourself to change positions every 20-30 minutes. Practice sitting with both feet flat on the floor. If you must cross your legs, Cross them at the ankles instead of the knees. Invest in a good chair that supports proper posture. For your stair technique, practice the proper techniques we discussed when no one is watching. Use handrails for support, not just balance. Take your time. Speed kills knees. Consider installing additional handrails if needed. For your sleep position, invest in supportive pillows for knee positioning. Evaluate your mattress. Replace it if it's causing your body to sink into harmful positions. Practice getting into bed in a way that sets up proper knee positioning. For your footwear, schedule a professional foot measurement. Inspect all your current shoes for wear patterns and support. Budget for replacing worn-out shoes. Consider it an investment in your mobility. Consider seeing a podiatrist if you have ongoing foot or knee issues. Long-term knee health strategies strengthen the supporting muscles. Weak muscles around your knee joint force the joint itself to absorb more stress. Simple exercises like straight leg raises, wall sits, and gentle squats can strengthen the muscles that protect your knees. Maintain flexibility. Tight muscles and tendons can pull your knee joint out of proper alignment. Gentle stretching routines, especially for your hamstrings, quadriceps, and calf muscles, can help maintain proper knee mechanics. Manage your weight. Every extra pound you carry adds approximately 4 pounds of pressure to your knee joints when walking and up to 6 pounds when going upstairs. Even modest weight loss can significantly reduce knee joint stress. Stay active appropriately. Regular low-impact activity helps maintain joint health by promoting circulation and keeping cartilage healthy. Walking, swimming, and cycling are excellent choices for most seniors. Monitor your progress. Keep track of how your knees feel as you make these changes. You should notice improvements in morning stiffness, daily comfort, and overall mobility within 2 to 4 weeks of implementing these changes. If you stayed with me through this entire video, it tells me something important about you. You're committed to taking control of your health and protecting your future mobility. That commitment could be the difference between maintaining your independence and facing mobility limitations in your later years. Here's what I want you to remember. Your knee joints have faithfully carried you through decades of life. They've supported you through countless steps, helped you climb mountains, both literal and metaphorical, and enabled you to chase grandchildren, explore new places, and maintain your independence. Now it's time to return that loyalty by protecting them from the daily habits that could steal your mobility in the years ahead. The 4 habits we discussed today, improper sitting, poor stair technique, harmful sleep positions, and inappropriate footwear, seem harmless because their damage is invisible and gradual. But now you have the knowledge to recognize and change these patterns before they cause irreversible harm. Start with just one change. Maybe it's being more conscious of how you sit, or taking time to improve your stair climbing technique. Maybe it's finally replacing those worn-out shoes or adjusting your sleep position. Whatever you choose, that first step is the beginning of protecting your knees for decades to come. I want to hear about your journey in the comments below. Which of these 4 habits surprised you the most? Which change are you going to implement first? Your experience could help other viewers who are facing similar challenges. If this video opened your eyes to the hidden dangers threatening your knee health, please hit that like button and share it with someone you care about. Your engagement helps ensure that more seniors get access to this potentially life-changing information. Don't forget to subscribe and ring that notification bell so you never miss insights that could protect your health and independence. And remember our community check-in. Type 1 if this video gave you valuable information you can use. 0 if it didn't meet your needs. Your feedback helps me create content that truly serves you. Stay strong, stay informed, and remember, every step you take to protect your knees today is a step toward maintaining your independence tomorrow. Your future self will thank you for the changes you make right now.